Welcome to Introduction to Portacaths. The objectives that we'll learn today are to determine the type of portacath, order the right accessing supplies, maintain the portacath, and de-accessing the portacath. So let's talk about types and locations of ports. First thing first, determine the location and the type of the portacath. You can see in this picture on the right hand side that we have a portacath under the skin. It is a round portacath, which is one of the older models. The newer models are triangular shaped with 3 raised bumps. This is an example of an older type of portacath, which is just a round port with a round septum. You will still find this type of portacath, but most have gone to the power port shown in the next slide. And this is an example of a power port. It is triangular in shape. The septum has 3 raised bumps, and it is the only port that you can do a CT contrast with. So a couple of items to address. First things first is palpation points on the septum. Second thing is triangular port shape. Third thing is power port device patient ID card. And fourth thing is power port device medical record. So you need to have 2 out of 3 of these in order to use power injection with a CT scan. So do not use or do not power inject for a CT unless a power port device has been verified by at least 2 of the 4 requirements from the previous checklist. This is an example of a power lock infusion set and is the only one to be used when power injecting for a CT scan. And we have these in the we have to order them from medical supply. This is a couple of examples of the packaging that you will see. On the right we have the power lock, and on the left we have the normal just Huber needle for regular insertion. This is an example of the current packaging of the portacath insertion kit. It's a sterile kit. It comes with a biopatch, and this would be from medical supply as well. Welcome to accessing the portacath. The portacath is the lifeline for the patient. Many of these patients are using the portacath for chemotherapy, so we got to make sure that we maintain it, that we keep a sterile technique, and that we do everything in our power to not damage or cause an infection. So here's a couple of examples of power ports. The one on the right is an older type of power cath or power port that cannot be power injected. The port on the left is a power port which can be power injected, and you can notice that it has 3 raised bumps and it's in a triangular shape when you feel it. First things we do is discard all the tubing used prior to initiation of the Huber needle. We want to obtain new tubing and flush with ordered fluids, and then document the tubing change. We also want to make sure that we have a physician order for accessing the portacath. If we do not have a physician order, we need to make sure that we get one. Obtain a portacath kit and appropriate Huber needle. The kit is on the picture, the upper picture, and the Huber needle is in the lower picture. Note, if we are not power injecting, the vascular access device can be accessed with any non-coring safety needle. Choose a needle length based on the reservoir depth, tissue thickness, and the thickness of any dressing beneath the bend of the needle. And the dressing that we'd be talking about would be the BioPatch. This is an example of a Cath kit. We'll get a better picture of it in a second. Okay, so here we go. We have the Cath insertion kit, and it comes with a BioPatch. We have one open here so everybody can see what's inside. First thing to remember is this is a sterile procedure, so you want to open the kit utilizing the 1-inch area outside of the cloth. Comes with tape and gauze. Comes with a pair of gloves. The gloves are one size, so you may have to go to the supply cabinet and get a size that you can fit. We have your ChlorPrep, which we use, which is very similar to the ChlorPrep in the insertion kits for IVs. We have the dressing. It comes with 2 masks. These masks, we have one for the patient and we have one for us. Remember that this is a sterile procedure, so we want to make sure that we are accessing the device with masks on, so that if I sneeze or if the patient sneezes or if we cough or anything, we're not getting anything on the site. You have your drapes, you have 2 saline syringes, and you have your BioPatch. You're going to need a Huber needle. Here's an example of a non-power port Huber needle. You do not want to lay it on the sterile field as I just did. So first things first, figure out what kind of power port you have and what kind of access you need. If you're going to be power injecting, you need to make sure that you have the power port and that you have the power injector Huber needle. So keeping everything sterile, you open the packaging, flop the needle down. It's going to be flushed. Make sure that we have all the air out of the Huber needle. You should see a couple of drops here in just a second on the sterile field, which will indicate that everything is flushed. You're going to access your site. Take off the cap, hold skin taut, 90-degree angle. You go down till you hit the back of the Cath. Once you get there, you're going to aspirate. As long as you have a blood return, you're good. Inject with a full 10 cc's and then flush again. Put your transparent dressing on along with the BioPatch first. So we want to place a mask on the patient and place a mask on ourselves. Each kit comes with 2 masks. Ask non-essential personnel to step out of the room during the procedure in order to limit the number of masks used to ensure that the technique remains sterile. Follow aseptic technique when opening the gloves that come with the Cath, or if you have to get your own gloves, and apply the sterile gloves. We're going to cleanse the area that where the Cath is. We're going to use the chlorhexidine and back and forth motion for 30 seconds and allow to air dry and not to fan. For years and years we were told to do your cleaning in a circular motion going from the center out, but it has now been found that we want to do a back and forth motion for 30 seconds and allow to air dry. This is an example of a chlorhexidine prep. We can see that it looks very similar to the IV kit preps. You're going to pop it, and then you're going to move in a back and forth motion for 30 seconds to get the area nice and clean. We're going to prime the Huber needle and tubing with the normal saline that comes in the kit. We're going to palpate the edges of the reservoir, locate the flat surface, hold steady, insert the Huber needle perpendicularly at 90-degree angle into the skin until it meets resistance, which would be the back of the reservoir. We want to inject 5 milliliters of saline and then aspirate for blood return immediately. If no blood return is present, follow problem-solving protocol, which is in the policy. Once placement is verified, apply clamps, remove syringe, attach needleless connector to cap, and attach IV tubing. Here's an example of the biopatch. The biopatch goes between the skin and the back of the Huber needle, and then you have your kit with it, which is a transparent dressing, very similar to the IV kits that we have. It's just much larger to cover the area. So one thing to note is that the Huber needles are replaced every 7 days with the dressing change. So it's not just the dressing that is changed, the Huber needle has to be changed every 7 days. So every 7 days the patient is going through a accessing and deaccessing of the Huber needle. Last thing, document dressing change, cap change, and condition of insertion site surrounding the area in the medical record. Discontinuation of a Huber needle. So the first thing that we're going to do is verify that we have a physician order to deaccess the port of Cath. After we do that, we're going to disconnect the tubing and the needleless connector cap from the Huber needle, extension tubing, and clamp extension tubing while keeping sterile. Next, we're going to aspirate a small amount of blood to verify placement, and then flush with 10 milliliters of normal saline. After that, we are going to inject 5 milliliters of heparin, and it is the 100 unit per milliliter version of the heparin. We're going to clamp the extension tubing and remove the occlusive dressing. We are then going to remove the needle by pulling straight out from the port while stabilizing the port by pressing down with fingers on the reservoir with our free hand. Place a dressing over the site, document the care, and describe the site.